If you love to travel like me, or your job requires you to travel a lot for your work, or you're a digital nomad and you're wondering about health coverage when you travel a lot, then this video is for you. So frequent travel can be divided up into travel within the United States and then also travel outside of the United States. So we're gonna cover both of those today. And so I'll start with talking about how health insurance works with frequent travel within the United States. So if you're somebody that travels a lot for your job, or if you're a travel nurse, or you just like to change your environment up, or you're looking at moving to another state, you're gonna wanna have a plan that is a PPO, so a preferred provider organization, and that gives you coverage across state lines. So a PPO typically, unless you get it on the marketplace, it's going to cover you across state lines, and it's gonna have a wide network of doctors and hospitals that you'll have an opportunity to have access to, okay? And so a lot of marketplace insurance is limited in this way, and that's because a lot of those plans are HMOs or EPOs, which are exclusive provider organizations. Those plans limit the network, which is really the doctors and hospitals that you have access to. And so if you're out of network, so if you travel a lot and you're out of network on one of those plans, you might not even have an out-of-pocket max, meaning that it's like not even having insurance at all. So you definitely want to keep that in mind, and have that top of mind and know exactly what it is that you need when you choose the type of plan. So some people that are on marketplace plans don't even know that they're not covered, or their coverage is very, very limited when they go outside of their zip code, or especially outside of the state that they're in. So let's say they go out west and go skiing, and they have a skiing accident, and they're on a plan that has a limited network, and they're out of network when they go to this other state. They might not even be covered at all, which means that they're gonna have to pay. It's just like having no insurance. And so if this sounds like you, or it sounds like you would benefit from an evaluation, reach out to me and I'm happy to assess that. And it doesn't even need to cost you a lot, and you could probably make the switch now and not have to wait to open enrollment. Now we're gonna talk about the frequent travelers who love to travel outside of the United States. So I get this question a lot from my current clients. What happens, Alex, if I have to, if I'm going away, is this gonna cover me? What if I have an accident? I just had a client the other day ask me, what if I have a heart attack when I'm in Mexico? Well, it's all about the network that you have access to and where you got the care, or where you're needing to get the care that you want covered. So if you have something really unexpected, like a heart attack, that's not gonna give you enough time to travel back to the United States and get your treatment here. So you're gonna have to get your care where you're at. And so keep in mind that plans that cover you inside the United States are not gonna necessarily cover you outside of the United States. So you're always gonna want to look into buying travel insurance, which is you can do it short term just for travel outside the US. And typically those plans are not gonna be too expensive, and they're going to cover you for the big, major stuff that would happen overseas. So if you're a frequent traveler, everything that you need to know is not covered in this video. It is a case-by-case analysis, and I'm happy to do that for you if you have any questions or are just curious and want to make sure that you're covered for everywhere that you travel, even if it's within the US or outside. Connect with me at alexthehealthagent.com and also on Instagram at alexthehealthagent.